Good afternoon, guys. We're group 4-7, so we're going to discuss about cestodes. Cestodes are classified under the subkingdom Metazoa, part of phylum Platyhelminths, which means the flatworms, and these parasites are considered as primitive worms. Cestodes or tapeworms, as you can see in the pictures, scolex small anterior hook attachment organ. It's a specialized segment that consists of hook suckers that anchor the parasite to the walls of the small intestine. Next is the neck, serves as the region of the growth and connects the head to the body of the worm. Next is strobila, division of the body into segments immediately following the scolex neck. Next is the proglottids, are individual segments of the cestodes attached to the neck region. As the parasite grows, the number of proglottids increase, allowing the organism as a whole to grow to several meters in length, and the length depends on the species. And most cestodes are long, and that can occupy the entire length of the intestine. The commonly caused human disease include Taenia sagittanum, Taenia solium, Diphylobotrium latum, and Hymenopis nana. Next is cestodes life cycles. All tapeworms or cestodes cycles through 3 stages. The first one is eggs, larvae, and adults. Adults inhabit the intestine of definitive host. Definitive host refers to the organism wherein the parasite reaches its mature form. So guys, makikita natin sa example picture natin is yung life cycle ng cestodes. Okay, example natin is sa tao. Paano nga ba nabubuhay yung tapeworm sa loob ng intestine natin? Siyempre cycle na, siyempre meron ding yung tao doon. Example na is yung pagpupo ng tao. Siyempre, hindi natin alam saan napupunta yung pupo natin, di ba? So, yung pupo na yon is meron siyang eggs. Pwede itong tapuan ng mga flea larva na kakain ng egg na yon. Siyempre, kapag yun, flea larva nakain na yung egg na galing sa pupo, ito namang flea larva is mag-e-evolve siya into pupa at maging adult. Siyempre, yung adult na yon is pwede siyang dumapo ulit sa tao o nang sa maging hayop man. Example, yung adult na yon ay dumapo sa pig, kakatayin, at ang pig na yon o ang pork ay hindi masyadong naluto. Siyempre, may mga eggs din yon. At lalo na pag hindi masyado nating pinakaluto, maaring makain natin ang egg na yun at mabuhay sila sa intestine natin at doon ulit ang cestode cycle. At example naman is yung sa animals naman. Gawin nating example is yung sa dog. May papanood tayong video para maintindihan natin. Ang adult dumapo na sa example nga natin ng dog. Papunta na sa host. At guys, ang cestodes natin ay no digestive tract. At ayun ang ating scolex. Lalabas na ang suckers at hook. Kung makikita natin ay humahaba ang ating proglottids. And guys, the length is dependent on the species. Co-contain ng female and male reproductive. Kung mapapansin natin guys, may mga natatanggal sa bandang dulo. Yun yung mga oldest and most mature segment. Kung mapapansin natin guys, kasama sa pupo ng dog ang proglottids na nagko-contain ng reproductive organs or ng eggs na pwedeng kainin ng isang larva at maaaring mabuhay ito sa kanyang intestine at sa kanyang pag-evolve na maging adult, maaari nitong maipasa sa mga hayop at maging sa mga tao na maaaring maging sanhi ng mga iba't ibang disease.
Diphyllobothrium is a genus of tapeworms which can cause diphyllobothriasis in humans through consumption of raw or undercooked fish. Diphyllobothriasis is Diphyllobothrium latum, known as the brood or fish tapeworms. Diphyllobothrium is considered a parasitic zoonotic infection. Diphyllobothrium latum causes a wide spectrum of disease and severity, like abdominal discomfort, diarrhea, and weight loss. This is the longest tapeworms in humans. It has 3 to 10 meters in length and has 3,000 proglottids. Echinococcus is the smallest of tapeworms. It is 3 to 9 millimeters long and it only has 3 proglottids. Echinococcus granulosus, also called the hydatid worms or dog tapeworms, and it has 3 to 7 millimeters length. Cystic echinococcosis, also known as the hydatid disease, caused by infection with the larval stage of Echinococcus granulosus that can be found in dogs, sheep, cattle, dogs, and pigs. Cyclophilids, cestodes that dwells in the small intestine of canids as an adult but which has important intermediate hosts such as livestock and humans, where it causes cystic echinococcosis, also known as hydatid disease. Cestodes. As compared to other parasitic worms, cestodes are characterized by a long, flat body that can grow to over 20 meters in length, depending on the species. Tetrabothrida. It consists of only one family, Tetrabothrida. Their hosts are mainly seabirds, and the rest being cetaceans and pinnipeds. Schistocephalus are found in isolated area of western and eastern North America, including Alaska and province of Canada and Europe.
Hello, I am Krista Magat of BSN 1Y2-7, and today I'll be discussing the intestinal cestodes. Intestinal cestodes, the adult cestodes form, are tapeworms that live in the intestinal lumen. So, ang intestinal lumen is the opening inside the bowels. The bowels make up the lower digestive tract. So, their bodies are composed of segments that include a scolex. So, ang scolex are used for attachment to the host. So, ano yung host? Host is wherein the parasite temporarily or permanently resides para makakain or magmultiply. Carrying the fixation organs that allow attachment to the intestinal mucosa, the neck, and the strobili containing segments called proglottids, carrying the reproductive organs. Human intestinal cestode infections are globally primarily caused by species in 3 genera, yung Tinea, Hymenopes, and Diphyllobothrium. Ang Tinea is a tapeworm with a long, thin, soft body. It has no legs and it can live in the human intestine. So, humans are infected through ingestion of raw and undercooked beef. Next is yung Hymenopes. They are infrequently seen in humans and they are commonly found sa rodents. Then yung Diphyllobothrium. Yung Diphyllobothrium is the largest tapeworm that can grow up to 30 feet long. So, nai-infect ang mga tao through consuming of raw and undercooked fish. Sporadic zoonotic infections caused by non-tanids are usually foodborne or nakukuha sa mga kinakain natin or due to accidental ingestion of invertebrate hosts. Usually, ang symptoms na ipinapakita ng infection na ito is only mild, and this include abdominal discomfort and diarrhea. So, paano malalaman if you are infected? So in most cases, tapeworm infections won't cause any noticeable signs or symptoms. Basically, may mga tao na asymptomatic. But in others, they can cause diarrhea, abdominal pain, nausea, and weight loss. Aside from that, symptoms also vary by the type of tapeworm you are infected with. So, depende sa kung ano yung tapeworm na nag-infect sa'yo, pwedeng mag-iba kung ano yung symptoms na ipapakita mo. Next is yung dwarf tapeworm or Hymenopeltis nana. Most infections with the dwarf tapeworm won't cause symptoms. Pero there are times na may mga symptoms talaga. And this include abdominal pain, diarrhea, loss of appetite, nausea, and weakness. And para naman sa mga bata, sometimes they experience anal itching or yung pangangati sa puwet, headache, and sleep disturbances. Ang tawag sa disease that is caused by this infection is Hymenopeltis. Ang treatment para dito is praziquantel or niclosamide as an alternative drug. So, paano siya ma-prevent and makokontrol? So, it is very important, no, na meron tayong proper hygiene and proper waste disposal, control of transport, host population, and rodent control. Sabi ko nga, yung Hymenopeltis is usually found sa mga rodents. Here is the life cycle of Hymenopeltis nana or the dwarf tapeworm. So, magsa-start siya as an embryonated egg in feces or tae. Egg is then ingested by the insect. Cysticercoid develops in insect. Humans and rodents are infected kapag kumain sila ng mga cysticercoid infected arthropods. Embryonated egg ingested by humans from contaminated food, water, or hand. After nun, oncosphere hatches, cysticercoid develops in intestinal villus. Then yung scolex, which is yung nag-a-attach sa host. Autoinfection can occur if eggs remain in the intestine. The eggs then release the hexacanth embryo, which penetrates the intestinal villus, continuing the cycle. Lastly, eggs can be released through the genital atrium of the gravid proglottids. Gravid proglottids can also disintegrate, releasing eggs that are passed in stools.
Hello, I'm Kristen Luis Guevara, and I will be reporting for the continuation of the intestinal cestodes. So, ang pangalawang klase ng intestinal cestodes ay ang Diphyllobothrium latum, na kilala rin as broadfish tapeworm. Ito ang pinakamalaki sa lahat ng klase ng tapeworm na may sukat na 3 hanggang 12 meters. So, saan ba makukuha ang tapeworm na ito? Base sa pangalan niya na broadfish tapeworm, ito ay pwedeng makuha sa mga isda. Specifically sa raw freshwater fish. Kapag tayo ay nakakonsume nito, ito ay titira sa ating GI tract at magkakos ng diphyllobothriasis at iba pang sakit. Commonly, asymptomatic ang mga infected nito, meaning wala silang nararamdaman na kahit anong simptomas. Pero mayroong iba na nakakaranas ng symptoms na abdominal pain, diarrhea, fatigue, loss of appetite, weakness, and weight loss. At dahil sa mga symptoms na ito, it can lead to vitamin B12 or cobalamin deficiency and furtherly lead to megaloblastic anemia. So, ang gamot na pwede dito ay ang praziquantel, which is an anti-worm medication, at pwede rin ang niclosamide as an alternative. As preventive measures, just make sure that you wash your hands properly every time you use the bathroom and wash and cook your fish thoroughly before consuming it. Life cycle of the Diphyllobothrium latum. First, the eggs will be released through the feces of the definitive host, which can be human or other fish-eating animals like birds. Then, it will hatch and form a larval stage, which is called chorasidia, which is then ingested by the first intermediate host, which are the crustaceans that are found in fresh water. Number 4, the procercoid larvae then develop in the body cavity of those crustaceans. These crustaceans are then eaten by the second intermediate host, which is the small fish. These fish then become infected. So, the procercoid larva released from the crustacean will develop into plerocercoid larva. After that, a predator fish, like salmon, eats a small fish and the plerocercoid invades its tissues. And if humans eat them and don't cook them properly, then they become infected. The tapeworm will then mature in the small intestine and will be released through feces, and the cycle repeats itself. So kung tayo ay infected nito, madadiagnose ito through the lab test ng ating dumi at doon ay makikita ang eggs nito. So again, to be able to prevent this, always remember to be careful of the fish that we eat. Make sure that it's clean and it's cooked properly. Make sure that we always wash our hands, and also, freezing the fish at negative 18 degrees Celsius for 24 hours can kill the larvae. Kung kakain kayo ng something with raw fish gaya ng sushi, ganon, advisable siguro to yung i-freeze muna yung isda for 24 hours bago ito kainin. For the last type of intestinal cestodes, we will discuss about the species of Tinea. So nandito ang Tinea saginata, which is the beef tapeworm, and the Tinea solium, which is the pork tapeworm. Huwag kayong papalito Kapag saginata, beef yun. Kapag naman solium, pork yun. Saginata, beef, solium, pork. So, unahin natin ang beef tapeworm. Common ito sa Eastern Europe, Russia, Eastern Africa, and Latin America. At base sa pangalan niya, nakukuha ito sa beef kapag nakakonsume tayo ng undercooked or raw beef. Nagkakos siya ng sakit na tiniasis at pangangati ng anal region. Majority ng patients na infected nito ay asymptomatic, pero mayroong iba na may symptoms na diarrhea, abdominal pain, loss of appetite which results to weight loss, and lastly, body malaise. Ang gamot para dito ay gaya ng sa diphyllobothriasis, ang praziquantel. So, paano ba maiiwasan ito? Always practice proper waste disposal and sanitation practices like proper hand washing. Also, make sure to cook the beef adequately before consuming it. It is also suggested to freeze the beef meat for 10 days for it may kill the encysted larvae. Tapeworm. So, maraming cases nito sa Latin America, Eastern Europe, Sub-Saharan Africa, and dito sa Asia. Base ulit sa pangalan niya, nakukuha ito sa pork, raw or undercooked pork, and it can cause tiniasis, the same sa beef tapeworm, at pwede rin siya mag-cause ng sakit na cysticercosis. The symptoms of cysticercosis depends kung saang location ng tissue siya infected and depende sa dami ng larvae. It can affect the skeletal muscles, heart, skin, liver, lung, or other tissues. Pwede rin itong umabot sa brain and mag-cause ng neurocysticercosis na pwedeng mag-lead sa serious neurological and epileptic complications. As a treatment, pwede rin ang praziquantel. If malala naman, surgical removal might be necessary, and sa case naman ng neurocysticercosis, anticonvulsants ang ibibigay ng doctor. So, ang preventive measures nito ay halos same lang nung sa beef tapeworm. Frequent practice of proper waste disposal and sanitary measures, and thorough cooking of the meat before consuming it. So, this is the life cycle of the Tinea solium. On the first one, the eggs or gravid proglatids and the feces pass to the environment. Then it will be ingested by the intermediate host, which is the pig. Oncospheres then hatch and penetrate to the intestinal wall and circulate to the musculature. After that, the oncospheres will develop into cysticerci. Then humans acquire intestinal tapeworm infection through the consumption of the cysticerci in meat. Then it will develop into an adult in the small intestine. So that's a cycle of the Tinea solium when it causes tiniasis. Let's move on to the one that has blue lines. After the eggs or gravid proglatids be released or has been released in feces and pass into the environment, embryonated eggs might be ingested by the human host, and the oncospheres then hatch and penetrate the intestinal wall and circulate to musculature. Then the cysticerci may develop in any of the organs, like the heart and the liver, pero mostly sa skin, brain, and eye siya. So, ito ang cycle kapag nagkakos siya ng cysticercosis. Ito naman yung life cycle ng Tinea saginata. As you can see, halos same lang siya ng life cycle ng sa Tinea solium. Ang pinagkaiba lang is yung intermediate host ay cattle. And wala siyang cycle for the cysticercosis kasi hindi naman siya nagkakos ng sakit na ito. So that's all about the intestinal cystodes. Always remember to be careful of the food that you eat to be able to prevent being infected with these tapeworms. Thank you.
Good afternoon, I'm Justin Fronda and I will discuss the extraintestinal cestodes. Extraintestinal cestodes. Adult cestodes are often acquired by ingestion of meat from intermediate hosts. Extraintestinal infection with larvae result are from ingestion of eggs of fecal origin. Diagnosis of infection with adult cestodes is based on identification of eggs and segments in feces. In other words, the adult cestode elicits little host inflammatory or immune response in contrast to the strong responses elicited by the larval stages in tissues. Tissue cestodes do not reach the adult stage in the human host. The organisms infect the human host in the intermediate or cyst stage. Larval cestodes cause infection by accidental ingestion of eggs excreted from the intermediate host, and they lodge in various organs and tissues in the human body. The parasites can cause serious disease or even death. Larval infections are difficult to assess. Tests like serology and biopsy are helpful. The control on preventing infections depends on sanitation, personal hygiene, and thorough cooking of meat and fish. Echinococcus granulosus, also called as the hydatid worm, hyper typeworm, and dog typeworm, is a cyclophilid cestode that dwells in the small intestine of canids as an adult, but which has important intermediate hosts such as livestock and humans, where it causes cystic echinococcosis, also known as hydatid disease. The transmission of Echinococcus granulosus in humans are by the ingestion of eggs and food that is contaminated with dog feces. The definitive hosts are domestic dogs and wild canids, while the intermediate hosts are sheep, cattle, swine, and horses. The symptoms of hydatid disease depends on the cyst location. The treatment can be surgical removal and albendazole. Echinococcus multilocularis is a small cyclophilid tapeworm found extensively in the northern hemisphere. Echinococcus multicularis, along with other members of the Echinococcus genus, produce diseases known as echinococcosis. The usual definitive host of Echinococcus multilocularis is the fox, with dogs and cats acting as the sources of human infection in endemic areas. Intermediate hosts are rodents and humans. The larval stage develops normally in rodents, but humans are unusual and poor intermediate hosts. Alveolar echinococcosis is an infection with the larval form of Echinococcus multilocularis, causes serious disease in various climate zones of the northern hemisphere. The liver is the primarily affected. The difference between Echinococcus granulosus and Echinococcus multilocularis is that the Echinococcus granulosus is a metacestode that grows slowly to form unilocular cysts that expand and crown the affected organs and tissues. While in Echinococcus multilocularis, it forms multivasculated cystic mass and shows peripheral infiltration with central necrosis, which resembles invasive malignant tumors. Diphyllobothrium spp. Diphyllobothridae are known to infect humans. These pseudophylladian cestodes have a scolex bearing botria, instead of suckers as in the cyclophilidian cestodes. All species associated with the human diphyllobothrid infections have marine or aquatic life cycles, and transmission occurs via ingestion of undercooked fish. In other words, Diphyllobothrium latum, which is the most common cause of diphyllobothriasis, are also called the fish tapeworm or the broth tapeworm. It is transmitted to humans by the ingestion of fish which harbor infectious larvae of the genus Diphyllobothrium, causing a wide-ranging spectrum of disease and severity. Tinea solium, also known as the pork taper. It belongs to the cyclophilid cestode family Tenidae. It is found throughout the world and most common in the countries where pork is eaten. It is a tapeworm which has humans its definitive host and often pigs as intermediate or secondary hosts. Tinea solium tapeworm infections can lead to cysticercosis, which is a disease that can cause seizures. Therefore, it is important to seek treatment when infected.